All right. Good afternoon, everybody. This is Mack at Hearing Healthcare Myrtle Beach reporting live on a Wednesday afternoon here in October. The weather is so beautiful here in South Carolina during October. Wish it was like this all year round. Anyway, today's topic of the live stream is hearing, hearing loss equal in both ears? What if I have one ear that's worse than the other? Or I feel like one of my ears I'm having a harder time understanding out of this side. Now, is that normal? Is that something that everyone experiences? That's what we're going to talk about today. So, for the most part, hearing loss is what we call symmetrical. So it's going to be the same on each side, more or less. It's never exactly the same. It's very rare that it's exactly the same on our test that we take when we get our audiogram. It doesn't always look exactly the same, but it's usually within a 5 or 10 decibel range each point on your audiogram of each other. Okay, now the reason for this is the most common type of loss we see is a permanent sensorineural damage, which is nerve damage. Okay, when you get nerve damage, it usually affects both sides at once because that's the eighth nerve, that's your auditory nerve, and it's being damaged, or it's your cochlea in your ear. Those hair cells are dying off about the same time. Okay, sensorineural loss. Now, most of the time we do see a symmetrical loss, but it isn't unusual to see one ear worse than the other when there's a cause. Okay, usually there would be a cause for this. Like, for example, we have some patients who have had what we call trucker's ear. If you're a truck driver for many years, you have a lot of noise coming out of that window that's right next to your left ear. Or if you're a farmer, for example, you keep turning around looking at your equipment, you're getting one ear exposed more to noise than the other, so that means that ear is going to sustain more damage and eventually lose more hearing. Okay, so usually when I see one side of deafness, there could have been trauma to that side of the head. There could have been more noise exposure on that side. Some reason that it's being caused. Okay, when we have seen a patient like that, that's completely normal. That makes sense that one side would be worse than the other, and as long as they have been cleared by an ENT or medical doctor, we're able to treat them just like we would a patient who has a typical nerve damage related hearing loss. That's equal on both sides. Okay. Now, if we have a patient who we notice that they have a non-symmetrical loss for no reason, no explainable reason, they might have just felt like they lost hearing in one ear all of a sudden. That's something that's a little more unusual, and we really like to get that checked out by the doctor because that could be a warning sign of something else is going on, either in the brain or in that specific ear, that's causing that hearing loss to be more severe in one side than the other, significantly more severe. Okay, so when we see that, we refer out to a doctor and we make sure that patient gets cleared and that there's nothing else wrong before we do any type of hearing aid fitting or help them out here. Okay. Another thing to consider that could have caused one side to be worse than the other is what we call a conductive loss. Okay, now what's the difference between a conductive and a sensorineural loss? Like I said, sensorineural, that's nerve damage related loss. It's permanent. Has to do with either your nerve or your inner ear. That's where the hearing loss is taking place. Now, conductive loss is going to be usually something that was caused by middle ear difficulties or something in your outer ear canal that's either blocking the sound from being transmitted or not allowing the sound to be transmitted properly to your inner ear. Okay, so someone with a lot of ear infections might have had some damage going on in their middle ear. They might not hear as well out of that side. Okay, or if someone's ear canal is abnormal, it closes off or something like that, that would be a conductive type of loss as well. Okay, so whenever we see any type of conductive loss in a new patient, we make sure that they also get referred to an ENT to see exactly what's going on, because that goes beyond our scope of practice. We are not, I'm not a medical doctor. We are specializing in the fitting, testing of hearing aids and hearing devices. So if we see that there's a possible medical issue beyond a simple nerve damage related loss, then we refer them right away to a doctor to get that checked out, because it's very important that if there's anything going on beyond that, that your doctor knows about this and is able to treat that for you. Okay, so let's see. So if you feel like you're having one ear that's getting worse than the other, I would go to your local hearing specialist. Please come in to see us for your free evaluation. Our number is right on the website, and your specialist will be able to tell you what could be going on with your ear, and they will refer you out if that is a necessary thing to do. Because sometimes if we have, like we talked about in our last video, if we have earwax, that can also cause a problem. If you're just one ear is full of wax, you're not hearing as well out of that side, that's something we would say, hey, you need to go to the doctor, get that cleaned out. But otherwise, yeah, we're looking forward to seeing y'all come in to see us here. Please give us a call. Numbers on the website. Schedule your free evaluation. And that means free, no charge. We do not charge people for their evaluation to get their hearing checked here. So come on by. There's no reason not to. Come say hello. All right, we'll see you later.